That mirror is in front of you, so you look at it and then you see behind. This is exactly what I'm doing when I'm working on the patient. Now, if I keep my mirror here, do you think that the spray will be covering the mirror, the reflective surface? The spray will not come on the reflective surface. Whereas if you place it here and you try to work like this, you place it behind the head of the handpiece, definitely you will find that the spray will come onto the mirror and you will not be able to see very clearly. This side, the other side, so that people can see exactly, go down below. Now what function is this mirror doing? The first thing is it is reflecting the cheek and it is also reflecting light onto the tooth in question. I already have direct light on it, but I want to enhance the illumination. Now let us suppose I'm working on the lower left side. So in which case what I will do is I will slightly change my orientation. I will move to the 9 o'clock position. Again, I will use the mirror to reflect the cheek. At the same time, I will position my handpiece in this manner and then I will prepare whatever cavity that needs to be done. Remember that the shank of the handpiece is always parallel to the occlusal plane. Never keep the shank this way, right? So always keep it parallel so that your burr is perpendicular to the occlusal plane. Okay, that is as far as the lower left is concerned. Now for the upper left. Now in the upper left, what you can do is again, you can slightly take it to the side, stabilize it, and then see here. In this case, what am I using? I'm using the finger rest, the ring finger to reflect the cheek. Reflect the cheek at the same time, stabilize the tooth.
0.5. Okay, this is a base for smiley face. This line is a dental junction. It's very clear inside the tooth, sound tooth structure, and the pin is 0.5 mm inside the dentition. We're in this line angle, this corner, in the distal and the lingual wall. Okay, this is where to put the pin. Second, I use a 1/4 burr to drill the pilot pin hole. Okay. There was previous pins, so there's a. I appreciate the size of it. Slightly wider than 1 mm. Depth is 1 mm already. And I prepare also to the mesa side, meaning like I draw there, like a crescent half circle. Any other questions?
The chest. Okay, now if you see, are there any gaps? Okay, are you all following still? Right, so that means I have 0.010 inch undercut at the distal buccal surface of this premolar as well. Okay, again, I'm going to make the marking. I'm going to write down. Okay, I'm going to write down 0.010 at the distal. Okay, so this is for my reference. Later, I don't have to sit and come back and decide, oh, how much was the undercut on which. Okay, I see here, I know how to mark it.
Okay, just adapt. Okay, for 2 mm uniform thickness, and with the handle and rest the excess and finishing you have to do using the hole.
porcelain here. This one, for example, is what they call porcelain fused to metal, or BFM, or metal ceramic crown. Metal ceramic crown. It's actually a British crown. Things look like deficient or no anatomy. Because later, they will paint them with porcelain. Paint them with porcelain. Yeah? Paint first and then fire in the first interface. Okay. So, the wax pattern is not properly anatomically proper because you need to give space for the porcelain, right? Okay. Here as well, you can see, not anatomically proper because you need to give space for the porcelain liquid. Okay, there's one liquid and powder. How do we mix these? We can use this here. We put powder and liquid and then we mix with a brush. Dip in the liquid and then carry out with the brush from the powder. And then they use to paint the, because after you remove the screw, you paint out the metal coping. They call these copings. That's what it is. Now, they are not crowns because not fully anatomical crown. They call them copings. So they use this coping, they paint them with the liquid and the powder porcelain. Of course, this one needs an artist, not me. Yeah, so that's why I'm going to mix this. Okay? So this is our procedure, and I'm going to do 3D printer again, not operational yet, waiting for the supplier to give the software writing or something like that. I'm not sure yet. It's not yet operational. Again, what it can do or what it cannot do, so yet to know until it's